Thanks, Sarah. I want to emphasize we didn't get to some of my favorite questions, so we'll definitely be reviewing those as we revise these papers. Um, I wanted to thank the audience for sticking around with us for 8 hours today, and thank all of the presenters. It's been a great lineup today, as I said yesterday, an all-star lineup. Um, I also want to thank a score of people that have been working behind the scenes at Apt and Hatcher to make things go smoothly today. Um, and particularly, I want to thank SSA. So Jeff, Debbie, Bob, and Kilolo for making this possible. Um, uh, as I said at the very outset, this is a project that's been 4 decades in the making, but really it's just been a breakneck pace of a few months here that this has all come together. And then last but certainly not least, I want to thank the ASL interpreters, Audrey on screen right now, Mary Beth just added here, and earlier today we had Kelly and Andrea. What you guys are doing is looks like a superpower to me, but I'm very impressed. Uh, and then I just want to turn it over to Jeff Hemmeter to make some concluding remarks. You may have heard earlier a reference to Chapter 1 in the resulting volume that will capture some of these introductory and concluding remarks. But Jeff's going to summarize some of our remarks today.
Thanks, Austin. And I want to thank everybody again, just as Austin did. It's been an amazing day. I want to thank everybody who's sticking around until almost 6 o'clock on the East Coast. I want to thank everybody who got up at about 7 a.m. on the West Coast, and everybody who's been here for all the time in between. The experts did a great job presenting and discussing many important lessons, and I just want to provide some overarching thoughts on some themes throughout today's discussion. First, it might be necessary to reset some expectations about how many beneficiaries are going to return to work absent a very large program change. The interventions tested so far have not resulted in large numbers of people exiting the programs, even when they increased employment. Work can be a good outcome in and of itself, though, even if it doesn't constitute sustained SGA in a competitive labor market. Other quality of life outcomes are also important. Broad tests of underlying assumptions of many of these policies may also be useful. Things such as the so-called ultimate demonstration that would test the underlying residual work capacity assumptions of beneficiaries by eliminating all consequences of work on the benefit. A second lesson that we heard today is that many demonstrations test packages of policies or services, and many of these evaluations have been unable to disentangle the effects of each piece. Future demonstrations should, when feasible, include additional meaningful treatment arms to allow SSA to determine the impact of specific intervention components or alternative policies. Only knowing if a package works or not does not always let policymakers know if it's overprovided, in which case similar effects could be had with fewer resources, or whether the theory is sound, but the amount of resources necessary might make it cost prohibitive. However, planning such studies takes time and sufficient resources and prior research. Sometimes that always doesn't fit into the timeline SSA is given for a demonstration. A third lesson dealt with new data matches, qualitative data, fidelity metrics, and other information about intervention implementation. And those are often necessary to go beyond the impact analyses presented at the end of a demonstration. How services are delivered is important to understanding why there was not or was an effect, depending what the case is. A fourth lesson that we heard today was that different populations have different needs. Targeting can be challenging, but also more effective. While DI and SSI are national programs, some policies or services may be more of an incentive or otherwise effective for certain groups. SSA already acknowledges this. For example, in the disability determination process, those older than 50 are subject to additional considerations based on their education, and in the work incentives, where the blind and youth have certain dedicated policies. Interventions that focus on specific groups might be more productive than policy changes or services that apply to everyone. A final lesson, and as Dr. Kichikazi mentioned in the keynote, is important to ensure a diverse set of researchers and participants in the demonstrations. We need to ensure people with disabilities, people of color, and people with lived experiences in the programs are included in the design, implementation, and evaluation of interventions. Different perspectives bring new ideas to all areas, and disability policy is no different. Overall, though, I think the discussion today has shown that SSA can conduct operational policy demonstrations, service-based demonstrations, nudge-style demonstrations, and a variety of other ones. It's partnered with federal, state, and local agencies, community health centers, schools, nonprofits, and others. As SSA moves forward developing new policies, demonstrations can clearly have a role. Used appropriately and judiciously, demonstrations provide rigorous evidence testing whether the most well-meaning policies have the intended effects and helping to ensure that ineffective or harmful interventions do not become permanent pieces of disability policy. Just one more thing. Just because SSA's DI demonstration authority is expiring soon, as we mentioned at the beginning of the day, this doesn't mean that demonstrations are actually going away. As I mentioned at the beginning of the day, SSA still has 1110 authority, general research and programs, and also SSI waivers. Using that authority, SSA has a new interventional cooperative agreement program to let external groups propose ideas and partner with SSA on tests of new, mainly external programs and policies. Many of the services discussed today are primarily provided outside of SSA, and this program will allow experts and providers of those services, rather than SSA, to help identify what might be the best interventions to test. The competition for that closes soon, so stay tuned to SSA's website to find out more about what becomes of that. If you're interested in that or any information about demonstrations, including when we release findings and reports, we do have a What's New page, and I believe the next slide will tell you how to sign up for that. But again, finally, I just want to thank Austin, Jennifer, Laura, Sarah, Daniel, Kara, Lauren, Jenny, and everybody at Abt and Hatcher, the interpreting team, and everybody else for coordinating this and making this happen. Thank you again for participating. And once more, I'll turn it over to Austin. Thank you.
The overarching findings there. So as Jeff alluded to, there's a lot more information on the website where you signed up for this meeting. One of the things there is how to sign up for the SSA demonstrations list there. There's also contact information where you can get in touch with us and give us any feedback that you'd like us to consider as we revise these papers for the book. The cover of the book there is shown there. So you know that book is coming in the fall, and you can also sign up for more information on that same website. So that's SSA demonstration lessons, aptassociates.com right there. And we hope to connect with you and discuss these issues with you in the future as well.